Well, July is the month we take time to focus on skincare and health as we spend more time in the sun.
Yeah, especially because Colorado has the highest per capita rate for skin cancer in the nation. Our Mountain Newsroom reporter Spencer Wilson spoke with a dermatologist and a patient who just had surgery yesterday, getting some skin cancers removed.
If you're anything like me, you haven't been always great about putting sunscreen on every single day, even though we're really supposed to here in Colorado. Now, living in a high altitude like Summit County, it's even more important because you can get extra sun damage just by living up here, and it can be accumulative too.
You can see part of it right here. Here's one of the other ones on top of my head.
Arthur Hardin was kind enough to show off his bandages, where a dermatologist lopped off a basal cell carcinoma, the wimpiest of the three types of skin cancer, and a pre-melanoma, the most dangerous kind.
Cancer was discovered actually by my barber, who she found that she saw him and sent me to, and I suggested I go over to the dermatologist, and the dermatologist looks at, yeah, you got a couple, so, and she had those done yesterday.
Arthur is your standard Summit County resident, biking, hiking, skiing, spending time out in the sun, above 9,000 feet. That elevation is a part of the issue.
For us in Colorado, the latest figures are that for about every 100,000 people, 21.9 get diagnosed with a skin cancer every year, whereas nationally that number is 19.7. And I know that doesn't sound like a very big difference, but it actually is, and puts us at the highest per capita rate.
So that's the bad news. The good news is that all of this is preventable if you're diligent with your protection. Sunscreen over 30 SPF, and clothing.
I always say you don't have to reapply your clothing usually. So far, you're looking just fine.
Dr. Blankenship checked for issues on my arm while we were there. Men typically have a little extra trouble getting a sun protection routine down.
For the most part, people out here get it. They go outside, they get sunburned, their friend has had a skin cancer on their face, so they've seen their friend go through that. They're like, I don't want that to happen to me, so they're willing to do the sunscreen.
And while skin cancer is a serious thing you do need to watch for, it's almost always treatable if you go in and check. Most skin cancers are the two lesser versions, not melanoma.
And they account for roughly 98% of skin cancers. 2% of skin cancers are the melanomas, and most melanomas, if caught early, can be easily cured. It's really a small portion of that 2% that go on to cause mortality.
The big takeaways from all of this are, yes, wear sunscreen. Yes, you should cover up in the event that you're outside in the sun or out on a bike ride. But the big one is go get checked at least once a year, twice if you think you might need it. In sunny Summit County, Spencer Wilson covering Colorado First.